Mbali, thank you so much for your time this afternoon. Does it have anything to do with the fact that there's now less money to go around, or is there another reason?
It's a combination of reasons. There is pressure to the employers in terms of employees feeling that they just cannot afford. And I think that is what is causing the employers to make it optional. It's voluntary now to participate because employees are struggling because the take-home pay is getting lesser and lesser all the time. So where do they look if they want to increase the take-home pay? It's insurance, not realizing the risk that is created by doing so.
So tell me then, is medical insurance then, the one alternative that people are looking to and employers are probably considering as well?
That is the trend that we are seeing, that people are cancelling medical aid and going more towards the medical insurance. But what is critical is that there needs to be an understanding. You need to be well educated if you want to go the insurance route, because it doesn't cover all your needs. So you need to make an informed decision if you decide to go on the insurance rather than as compared to medical aid.
So let's then talk to someone who's watching tonight, because as you say, it's important to be educated. So what is the difference then for someone who's asking themselves, who's watching tonight, between a medical aid scheme and medical insurance?
Okay, the biggest difference on the two is that medical aid will cover you for hospitalization as well, where medical insurance doesn't have hospitalization. You will get your day-to-day benefits. You will get some of your chronic medication. You will be covered for emergencies and accidents. So if you are in an accident, you might be taken into a private hospital just to be stabilized. After stabilization, you go to a public hospital. You will get your chronic medication on the health insurance as well in most of the health insurance covers. But all of them do not offer hospitalization, and they are not governed by the Council for Medical Schemes. So it's the outside that's regulator.
So basically then, if they talk about, because some of them, when they make, just try to get you to be part of them as part of enticing you, they will say that for hospitalization, for example, you could get benefits of up to maybe, let me say, 62,000 Rand. So that 62,000 Rand, is it just for stabilization? So if I'm hearing you correctly, it's not for the entire stay in hospital.
That is correct.
Sure.
That is correct. You will have a limit, but that limit will only apply on emergencies and accident stabilization. And then you reach that cap, then you will have to move out, or you will have to pay a difference if it exceeds that maximum limit.
So how then because the shrink when it comes to people taking up medical aid has been happening over time now, how then are the medical aid companies, discussing this, coping with it? Because this picture is changing drastically.
There is a lot of conversation that is happening. Even the industry bodies are addressing the issue. But at the end of the day, it's a member's decision. It needs to be a decision that is made by the member, because there is a contribution that needs to be paid. So the concerning picture, really based on my research that I shared, is that the youngsters are really opting out, which is quite a big concern, because we're sitting with the future population of this country without any cover. And we know that NHI is not yet in place. And if we are depending on the fact that NHI will be implemented and we will all have cover, it's not going to happen tomorrow. What happens if you are faced with a condition that requires intense medication, hospitalization, etc.?
So why are young people, according to the research that you've done, not interested in medical aid, particularly those who aren't?
It's mostly affordability. The prioritization, and even in terms of the research that we did, the healthcare is at the bottom of the pack. if you look at what they prioritize, their prioritization is skewed in terms of health. When you talk to them, they really value health. They're into wellness and everything. But when it comes to spending patterns, the spending patterns are not aligned to what they are saying when you talk to them.
So basically then the picture that, I saw someone talk about a few years ago to say that they start considering it when they turn maybe 40 and above is not changing somewhat.
It's not changing. It's actually becoming worse.
Sure. Now, when you then look at the fact that, as you say, NHI is not in place and it looks like it could still be a long way off before this, actually does come into play. It then simply means that then there is now this opportunity of young people who are simply not, insured. Some of them aren't even employed. So how then do you as an industry begin to take them into consideration, given the fact that they potentially may want to be part of this, but they simply don't have the means?
That is where the medical insurance then come into play. Because rather than having nothing, medical insurance is more affordable. And our approach is that as employers, you need to have at least the basic, which is the employee assistance program in place. You can have clinics, you can have a nurse facility for your employees. There must be at least something in place that people can reach out to. And what we are saying, looking at a holistic employee value proposition, we are coming up with now solutions that are integrated, that if you as an employer are participating in an umbrella fund for a retirement fund solution, you need to look at your employee value proposition holistically and not only look at retirement, because there is nothing worse than saving your entire career life in your retirement fund, and when you retire, you are sickly and you have no provision for healthcare, and you take all that money and spend it on healthcare, and you don't enjoy your well-earned retirement savings that you were saving over years. So we say, let's bring in a balance and make sure that everything is in place. It looks across the spectrum, not just the one angle. Those who are unemployed, because we know that we are faced with a big issue of unemployment. You can then look at what sort of income can you get. Then you can have access to something like a medical insurance then, in that case.
Mbali,
but it's a tough one. It's a tough one.
It's a very tough one. Yeah, it's a very tough one, particularly when you look at the soaring number of, young people who are unemployed, but at the same time, people gravitating towards medical insurance, but it doesn't look like it could offer all the things that they would actually be expecting from some kind of cover. But thank you so much for informing us. Really, hopefully somebody is able to make sense of, everything you've just shared with us. That is Mbali Khumalo, Simeka Health, MD, giving us a very interesting take there on medical insurance.